All right, it's just about 2 o'clock, so we're going to get started in just a minute. If you haven't put your answers into the poll, please do so soon. Um, and we'll go ahead, we'll leave that poll up for just a moment, and we'll go ahead and get started on introducing our lovely panelists. And we're gonna go ahead, I'm gonna introduce you while we can all see your faces, and then I will start sharing my screen with our slide deck for the day. We're joined first by Roslyn Stone from 0 Hour Health and Zetic. Roslyn, thanks for joining us. We're also joined by Sarah Spah from the Minnesota Department of Health and Cathie Koch from Bloomin Brands. So welcome, thank you so much for joining us. For those of you who are just joining us, we're gonna go ahead and close that poll in just a second. So get your last little votes in. And thank you. All right, we're gonna close out that poll, and I'm going to get started sharing my screen here. So, sorry about that, here we go. All right. We're way at the back. We're gonna start right at the front. All right, here we go. So, thank you so much for joining us. Today, we're gonna be talking primarily about getting to, yes, improving vaccine confidence and uptake for your employees. As I mentioned, we're joined by Roslyn Stone, Sarah Spah, and Cathie Koch. Cathie is the Group Vice President, Corporate Affairs for Bloomin Brands. Sarah is a nurse specialist, an RN MSN at the Minnesota Department of Health, and Roslyn Stone is a Master's in Public Health and the founder of Zetic and CEO of 0 Hour Health. So Roslyn, why don't you start us off with a quick update about where we are now and what's kind of going on in the world of COVID. We were just talking right before the webinar about how there's always something new the day of a webinar that is, that kind of derails us. And rather than ignore those things, we've decided we're going to start every webinar with talking about where we are now. So Roslyn, why don't you take us away?
Thank you very much. And thank you everyone for joining us today. We know that we're all kind of webinared out, but we've heard that we're providing really good information and we're listening to you about what we want to present about. Just a little bit about who I am and how I came to be here for those of you who are new to the webinar. I am the CEO and founder of 0 Hour Health. We provide medical support services to industry. And this past year, we launched Zetic, which is a app-based service that supports smaller businesses, smaller restaurants, emerging chains. A large portion of our client base in 0 Hour Health is in the restaurant industry, although we also support some very large major corporations in the same kinds of things. Before this year, most of what we dealt with, the top 10 things that clients called us about were, things like norovirus, hepatitis A, TB, various kinds of infectious diseases, and flu. And we got into this business through flu and providing on-site flu shots. So we've sort of come full circle. My background is as a master's in public health and epidemiology. So that's sort of a little bit about who we are and where we are. Jen, we just lost the slides. If you could go to full screen, thank you. So what we are seeing is vaccine rollout is increasing daily. Everybody probably saw that the president yesterday talked about every adult having access to vaccine, or at least being eligible by partway through April. We're seeing great new data about vaccine effectiveness, and that's been really very good, very good news. There's some concern about the variants. We expect that this vaccine will continue to be effective through much of this year, but that in all likelihood, we will require booster doses and newer vaccines will be modified to address the variants. There are some variants that are of greater concern, and you probably saw the news this week that in fact there's 1 or 2 cases of people that have more than one variant that are infected with COVID with 2 variants, and that certainly is a source of concern. The other really good news is that we're seeing work exclusions changing and that there are fewer employees excluded for close contact, and that's as more and more people get vaccinated. We do see that we are seeing more employees start to get vaccinated and us getting the documentation on that. There was a news story just a few minutes ago, and again, Jen talked about how there's always a big news story or a big CDC change on the day of our webinar, and that story today was that Michigan, which is experiencing a really significant increase in the rate of COVID, has extended the employee exclusion or the exclusion of required quarantine back to 14 days. And that's going to impact employers, employees, and hopefully help them get a handle on what's going on in Michigan. Because that gets us to our next item, which is that we are seeing increased sickness every day. This past Saturday night, and we are taking into account that this past Saturday night was a holiday weekend, beautiful weather, spring break. People, didn't necessarily want to work on Easter Sunday. We had the highest case count that we experienced in our daily wellness checks back to January 16th, which was our previous high date. So we were at about 85% of that this Saturday night. What's disturbing or concerning is we're seeing that continue since the weekend. And some schools' spring breaks are over, and we're seeing those numbers continue to rise. There was a news story earlier today that said that almost 50% of the new COVID cases were in 5 states. And I'm not one that supports things being fake news, but I think that's only part of the story. We're also seeing reports that testing is really down in many states. So New York may have one of the highest COVID case rates right now, but New York is also testing a lot more people than other states. There was an example reported the other day in the news that New York is testing 1,200 people per 100,000 every day. Arkansas is testing 60 per 100,000. There are going to be more cases in New York when you're testing more. But we are seeing disturbing trends. We've had more clients that have had to close restaurant locations, shut down their offices in the last 2 weeks than we have had almost throughout COVID. And we had one client that had the most number of cases, confirmed cases in a single location. Personally, in my own circle of friends, today I know more people with COVID than I have throughout this whole process. And I'm not sure what to make of that. It may be that a lot of my friends were tired, as many of you and your friends were, and traveled last week and the week before for spring break. I have another friend who came back from their honeymoon, husband, both with COVID. So, it may be that we're easing so many of these restrictions, and that's what we're seeing. Last but not least, we're seeing states lift the mask mandates, capacity limits, and other precautions. And as much as that is really good for many of our clients' businesses, we're also concerned about how that's impacting the transmission of COVID. We're complicated right now by allergy season. Those of you who are in Georgia and North Carolina see your cars covered in pollen and know that that allergy symptoms might mimic flu symptoms, but there are ways to tell them apart. So where are we now? Really not in a great place, really in a worse place than we were when we had this webinar a month ago. So just to bring you back to our poll, clearly concern about vaccine side effects is without a doubt the number one concern that many of you have, very closely led by, how difficult it is to get an appointment. And when we turn this over to Sarah, she can talk about that a little bit. And Cathie certainly has tremendous experience with how difficult it's been, particularly in Bloomin's, home office state of Florida. The other concerns that rank high are the language barrier and the speed of vaccine development. And Sarah will speak to that. We may have had this really elementary issue that started at the beginning of this that none of us were aware of, which was naming it Operation Warp Speed, because that has reduced confidence in some people. And last but not least, we hope that in this next 45 minutes or so that we're going to address not necessarily how to get the 50% of your employees who want to get vaccinated. That's going to happen. How do we get to the next 30%, the 30% that are waiting or hesitant or undecided, and how we address their concerns? And with that, Jen, I'll turn it back over to you. And
yeah, absolutely. And one thing I'm really excited to hear you speak about, Sarah, is this 34% who say they need more info to make the vaccine decision. I know I've had a sneak preview at your slides. I know you're going to talk a little bit about that movable middle, and so it's interesting to see that the kind of the fourth ranking thing there is people who think that they need more time, who are in that movable middle. So without further ado, I'd love to turn it over to you, Sarah, to talk to us a little bit more about what's working in terms of moving that 30%, moving that middle. You know, who is accepting, how can we leverage them, and who should we just say this is not the people that we should be talking to. So Sarah Spah from the Minnesota Department of Health, please take it away.
Thanks, Jen. And I'm just going to review 3 things. And one is ways in which personal decisions are made and how they can be influenced. Common myths that you may see. I'm not addressing them all, but some common myths. And your employer, you know, your role as an employer and some resources for you. So the next thing I want to talk a little bit about is the next slide is going to be kind of ways in which personal vaccine decisions are made. Most of the research to date really focuses on parents in the context of routine childhood vaccinations, but many of these influencers can be applied to the adult population too. So when we think about COVID-19 vaccination, we think about, people think about their risk. What's their perceived risk of infection or adverse events from the vaccine, side effects? The benefits, what is the benefit to themselves and or the community of getting vaccinated? And thinking about, you know, decreasing severe disease, hospitalization, and death for themselves and in the community. Some of those social cultural factors that they're going to be thinking about is, you know, what education level do they have? Socioeconomic status can influence their decision. Language affects their decision. Groups influence their decision, such as family members, friends, classmates, neighbors, even religious affiliations. Even coworkers are going to influence their decision. It's who they're talking to about this. The other thing that influences them is trusting in science and medicine. If they do not trust in science and medicine, they may not believe that vaccine is going to work for them. One of the biggest things is their past experiences with vaccines and the healthcare system. Those who are experiencing injustice in healthcare, both past and present, may have less trust in the system, and it might take them longer to get comfortable with getting vaccinated, and they may want to get vaccinated inside the healthcare system. Another thing is receiving a recommendation from a healthcare provider. That evidence really suggests that really does help, especially for those who do have trust in the healthcare system. Exposure to media is huge, as you probably know. Although that social networks have always shaped knowledge and values related to the vaccine acceptance, electronic and social media sources have also helped disseminate misinformation about vaccines and bolster vaccine hesitancy. So we're always battling with that. Also, trust in who is delivering the message. I think this is huge. We really need to understand who the individuals value and respect and trust regarding the information they receive. So this may be different for different staff. So from an organizational standpoint, you may need to really think about your audience or your employees and who they're getting information from, who they trust, and look at those avenues to go forward. Next slide, please. Thanks. Understanding your audience is huge. Like we talked about, you need to know, are your staff vaccine acceptors, adopters, excited about to get vaccinated or already have been vaccinated? Those are your most powerful advocates. Leverage them to motivate and build that trust with the movable middle. And as we probably know, the movable middle is that group that's undecided or still hesitant. The biggest things that you can do with the movable middle is make it easy, influence and boost motivation, and build trust in vaccine safety. And the third portion of your employees are going to be vaccine refusers or detractors. And that's okay. There are going to be a small population that is just going to refuse vaccination. They made the decision not to do it. They may be more vocal, less vocal about their concerns. The biggest thing is just to minimize the negative impact they may have on other people to have vaccine uptake. Next slide, please. For the vaccine acceptors, like we talked about, they empower them as advocates. So really highlight vaccination of your trusted employees. You really need to know who do they look to within each other of their coworkers, those trusted employees. They may be informal leaders. They may not be your leaders or your leadership roles. Also, highlight who've taken the vaccine. These things like company videos or having a wall of fame with their staff's pictures but not only just the staff pictures, maybe some written reasons why they chose to get vaccinated. Again, there's vaccination buttons, bracelets, et cetera, to really highlight staff who've gotten vaccinated. Coworkers, particular similar background and seniority, may be the most effective and influential vaccine advocates. Also, utilize your convert communicators. These are going to be those individuals who are initially reluctant, and then they made the choice to get vaccinated. They can really be great resources, because those that are reluctant may think, hey, you can't, it's difficult to characterize that messenger as an other person who doesn't understand our circumstances. So definitely use those and highlight them. The movable middle, like I talked about, make it easy. They need to have accessible information on the vaccine and where to get vaccinated. That information really needs to be in plain languages and your preferred language for that employee. Again, there's a lot of scientific language out there that keep it simple. Also, I think this is the biggest key, and we talked a little bit about this when Roslyn was talking about this. Support your employees with navigating the system. It is difficult to get some through of these registration systems. If they do not understand, if their first language is not English and they don't understand the registration process, it's not only a language barrier, but helping them understand that. You may need to spend some time to walk through things with them versus just giving them information on how to do it. Also, vaccination clinics, transportation, how do you navigate those systems? Talk through it, not always just the written word. Offer choices on where they're going to get vaccinated. And I can't emphasize this one enough. It really depends upon who people trust and where they're going to get vaccinated. Employers, yes, make it simple, make it easy for them to get vaccinated. You may consider having a vaccination clinic at your site, but they may not trust the employer to provide the vaccination. So you really need to understand where they feel most comfortable. It could be healthcare providers and clinics, their local pharmacy, community events, state-run sites. Maybe consider asking some of your trusted employees where might be the best place to really promote a vaccination clinic, but give a lot of variety to that. Next slide, please. Movable middle. Use social influence and boost motivation. Again, use those trusted sources to share information. That is key. Community leaders, church faith leaders, community health workers. Think about those folks to help really share the information. Uplift those trusted voices and early vaccine receivers. So they've got vaccinated first. They're really going to tell their story and let people know, how was it? What were the side effects? What was the experience like? That is who you need to uplift early on. Relay the benefits of vaccination. Again, some benefits to the vaccination are being able to get together with family again, friends, attending some events. But again, we need to continue to get vaccinated to get enough immunity within the population so that we can continue to do those things. Consider offering paid time off for vaccination and or the day after. We do know that the side effects happen 1 day after, 1 to 2 days after. And just knowing that I might have that time and paid time may help me feel more comfortable to get vaccinated. And again, positive messages surrounding vaccination as a social norm. Highlight the trend toward increasing vaccination. Look, a lot of people are getting vaccinated. Emphasize that altruistic motivational message. It's helping to end the pandemic. Let's all do our part to end the pandemic. Focus on concrete, desirable things. Again, things that are going to motivate them to get vaccinated. Next slide, please. Again, still that movable middle, building trust in vaccine safety. Again, Operation Warp Speed was probably the worst title anybody could have given this, thinking that there was steps in safety that was skipped. There is a lot of information out there, and I'm not giving you that right now, but there is out there on CDC and our Minnesota Department of Health website. Use credible resources. Again, use the trusted sources to share this information. And it may not be you as an employer, but it may be a variety of people providing that information that they trust. Be transparent, be honest about the risks and side effects. Really review these side effects can be common. You might get a sore arm. You might get redness and soreness in that arm. You might get a headache. You might feel a little tired, but that generally goes away. And then also compare it to the side effects of getting the actual disease, or the symptoms of actually getting the disease, and how it can really affect people. Combat distrust of vaccine development processes, and debunk the myths that are out there from social media especially. For vaccine detractors, this is where you really want to just emphasize that there is freedom to decline, refuse, or say no. The more we force people into a decision, the more walls we tend to put up. So I just acknowledge too, some people are just going to choose not to be vaccinated, but be prepared to deal with negative comments in that non-threatening manner. Next slide, thank you. How decisions can be influenced. So there's other effects. Targeting specific unvaccinated population. You may need different ways to do that for each of these population. Increase their vaccine knowledge with credible resources like we talked about. Message that emphasize vaccine efficacy and mitigate fears of side effects. Those are important. Improve access and convenience to vaccination. Engage trusted religious and community leaders. So kind of know what is going on in your community and maybe what other avenues people are getting information or getting resources from, and work with them. One of the biggest things is the effective interventions is community-based. So I know there's a lot of national, maybe restaurant associations, but really need to look at that community-based, no one-size-fits-all solution. So I just wanted to review a couple of common myths. I'm not going to go into all the details, but there is a lot of myths that the COVID-19 vaccine causes infertility. There really is no evidence that that causes fertility problems, both from CDC and the American College of Obstetrics and Gynecologists. So please know that we really still encourage people that are pregnant to talk to their doctor about getting vaccinated so that they can have that benefits and risk conversation to get vaccinated, but it's not a requirement that they have to do that. Next slide. Common myths. Again, the COVID-19 contains microchips. And again, that myth was developed to control the general population, either through microchip tracking or nanotransducers in our brains. No vaccine microchip, and the vaccine will not track and gather personal information. Gave you just a little bit of how that myth started, and that's from the Mayo Clinic. Another myth is COVID-19 vaccines will alter my DNA. Again, the fact is that the messenger RNA, so Pfizer and Moderna vaccines, is not able to alter or modify a person's genetic makeup or their DNA because it never enters the cell of the nucleus where DNA is made. After that vaccination is done and the mRNA does its job, the body actually is very capable at destroying that and removing it from the body. So in terms of the employer's role, just know that every one of your employees may be at different stages in their decision to get vaccinated. And really, truly, your goal is to provide education and build trust with your employees. Provide that information to employees to make the best decision for themselves and their family. Provide resources and support to get that vaccination. Next slide, please. So the employer resources that I gave you, and this is just a few, there's so much out there, as you probably all know, but there's an employer toolkit that you can take a peek at, and that is from the Minnesota Department of Health. There's also a frequently asked questions about COVID-19 vaccination in the workplace for employers. If you haven't checked that out, I would. In Minnesota only, we do have the vaccine connector, and really encouraging the general population in Minnesota residents to get set up with the vaccine connector. Again, people might need support on how to do that if they're not familiar with that. And then CDC also has Vaccine Finder, which can help to find locations of vaccination clinics. Next slide, please. So we all know that information needs to be provided in multiple languages. So I did highlight the Minnesota Department of Health because we really do have a lot of information on COVID-19 vaccine in multiple languages, because we do have quite a diverse population here in Minnesota. Once you click on our website or the link that I actually gave you, if you look at the sidebar for other languages, you'll see that we do have multiple languages in Hmong, Somali, and Spanish. If you scroll down on that page, you're going to see information on COVID-19 vaccine basics, getting vaccinated in multiple languages. Next slide, please. And I just wanted to end with a quote from Ms. Tina Sandri, who is the chief executive of a skilled nursing facility in Washington, D.C., who went through many struggles that you are facing or may be facing in getting staff vaccinated. Her pearls of wisdom are, everyone's fears are real, whether or not they're grounded in science or something they believe right now. Beliefs change with time or new knowledge, so we have to ride it out. Listen hard, don't judge, and let them move at their own pace. Thank you.
Thank you so much. Go ahead, Roslyn, were you going to say something?
Oh, I was saying excellent. And just something that I didn't say at the top, but I meant to. Those of you who are our clients at 0 Hour Health and Zedek know that we turn to the Minnesota Department of Health as our example of how a health department partners with businesses, partners with restaurants. And as I said to Sarah before the call started, they are the best detectives in the business. And when we want to know something that's going on anywhere in the country, they are the first place that we turn. And that's how Sarah came to join us on this call today. But Jen, I'll turn it back over to you to turn it over to Cathie.
Excellent, thank you. And for anyone looking for those resources, during the Q&A section, I will drop them into the chat, and then we'll email them out to all of you with the recording of the webinar within a couple of days. So you'll get access to all those resources that Sarah shared. And now, speaking of people that we turn to when we really need them, when we were thinking about communication and who could help us talk about how to communicate effectively with employees, Cathie Koch was the only person we considered. So Cathie works for Bloomin Brands, a very long time 0 Hour Health partner, very long time. We go way back. We've been through many things. And so Cathie, would love to turn it over to you to chat with us a little bit about your experience and your tips for communicating with employees effectively. Oh, Cathie, you're still muted. There we go. Now we can hear you.
Thank you all. So I'm going to just spend a few minutes explaining how at Bloomin Brands, we're actually bringing a lot of what Sarah just mentioned to life. We also approach this in an 80-20 fashion. The 20 for us, similarly, is there are 10% who lined up that we didn't need to talk about. They are yes already. There's another 10% that no matter what we say, they're not going to get it. And that's okay too. We decided to focus on the 80% in the middle. And we tried to do that through encouragement and removing obstacles that could get in the way of them getting vaccinated. And we believe that it starts at the top. But what's important is you have to identify who the top is for every person, right? Because it's different based on the situation. We are fortunate. Our CEO, Dave Dino, is all in. He was talking about getting the vaccine last year before we even had an inkling of the timing of it hitting the market. He said, I'm going to be there as soon as possible, and I expect all of you to be too. Well, of course, that resulted in lots of conversations. And we ended up with the position of strongly encouraging all of our team members at the Restaurant Support Center and in our restaurants to get vaccinated, and we'll support you in doing so. But in messaging that, we really wanted to take it beyond that, and very similar to what Sarah said. We wanted to make it bigger than ourselves or bigger than the individual. And we are challenging our team members to think about it as help us to raise the bar in our communities, in the communities where we do business, in the communities where we live. And then Dave followed up with that, with a letter in January that really spelled out our position again. And from there, we just hit the ground running. But what's interesting to remember is, it's all great that Dave likes it, but but who is the top? If, we recognize that the top in a restaurant is most likely the partner. And so we are counting on them as well to help reach that 80%. And the way we're doing that is using the right tools. We tapped our ops services team to lead this project. They're the perfect group for this because day in and day out, they are talking to our frontline employees. So in addition to the regular channels that they typically use, this group has created some impressive new content, starting with a website that includes everything from local vaccination states, with local vaccination opportunities by age, by state. It's updated almost every day. We have a group in our legal team that scours the states every night and updates that information daily. We have third-party education resources. We created a video using our frontline employees talking about why they're getting vaccinated, and then there's this cute little map that has different circles on it, and you click on the circle, and it's a different frontline employee saying why they're getting vaccinated. And it's everything from, I can't wait to hug my grandmother, to I'm ready to start dating again, Zoom is getting boring. But lots of that peer-to-peer conversation for encouragement. We have videos of celebrities telling their stories. We have photos. Our team members, as they're getting vaccinated, are submitting photos, and we're sharing that out too. Again, enhancing that peer-to-peer connection. We have some eye-catching graphics on our communications channels as well that the hourly employees use every day. We're using the 0 Hour Health chat line and web link for folks to ask questions. We've created postcards that we're giving to each of our employees in the restaurants with our key messages and web links and QR codes to help them get there faster. So we are using the broad spectrum from technology to old school piece of paper in somebody's hand. And of course, that's in English and in Spanish to help encourage folks to get vaccinated. And then as for measurement, we also created a dashboard that operators can use to measure success. And these are filtered company-wide, and then by brand, and then by area, and then by restaurant, and then by restaurant, front of the house versus back of the house. So each partner can really take a look at the progress that they're making and can zero in on where they might need a higher touch point from time to time. As for incentives, when it came to incentives, we landed on 2 hours of pay for every shot at the end of the cycle. We noticed that larger retailers were not providing incentives, but that grocery stores and restaurants and hotels were. We felt that was the environment where we lived, and in 2 hours of time per shot, what was the right place. Again, going back to our original premise of removing any obstacles that might be in the way of someone getting a vaccine. So this could help pay for gas, for transportation, for daycare, so that someone can't say, no, I can't take the time off. I can't afford to take the time off. Well, we're paying you to help you with that. So I have to say it's been well received, and I suspect it's well received in every company that's offering some sort of incentive in that way. And I think it's important with anything to customize the message that you're putting out there, as I'm sure it is for everybody listening to this webcast. Our people are our most important asset, and we need to reach them where we are, where they are, especially in this very complicated topic. It's emotional, it's physical, there's fear, it's important. Empathy has never been more important than it is today. And of course, that means different things to different people, and it's hard work. If you're a partner running a restaurant, it's hard work to say, okay, I need to slow down and give these 6 people a high touch point today to see, to check in with them and see where they are. But that's where the tone at the top really matters. So the tone at the top at the restaurant. So if the partner is having any hesitation at all, like, why am I doing this? oh, it's because our CEO is behind this as well. So I can't stress enough how important that is. But overall, truly, the best advice that I can give anyone listening when it comes to getting to yes is to provide clear direction. Do so with a positive tone and outlook, with the foundation that this is to take care of each other, to take care of our families, and to take care of our communities. So we are very early in this so far. We are energized by the progress we're seeing so far. We've got a long way to go, but we will continue to measure and adjust as we go, depending on what we learn.
Wonderful. Thank you so much. I think it's so helpful to hear, at the high level, like what is working to get people in the movable middle that you discussed, Sarah, and then to hear it put into the context, the very specific context of restaurant operators, and how it actually works for you at Bloomin Brands, Cathie. So thank you so much.
Sure.
We're gonna switch into the Q&A. Before we do, Roslyn, do you have any parting words for us before we get into live Q&A?
I just wanted to mention one thing. Cathie mentioned our vaccine chat line. That was not a service that we offered. Bloomin was one of our very first customers. We started doing flu shots in Outback Steakhouse when there were 40 restaurants. And I should know how many restaurants there are off the top of my head now, but we have grown together over the last 2.5 decades. And Bloomin came to us and said, we found that one of our, one of the things that we're hearing from our employees is they need another good source of information, and you are our source of information, so we should share that with our employees. And we did go ahead and spool up this vaccine chat line, and we're just every day fascinated by how good the employee questions are, that they're thoughtful. They're looking for good information, and we very quickly found out that they were looking for good information in their native language. And we're fortunate that at least half of our clinical team or more are bilingual, and that became really important. But I did have one question for Cathie, Jen, before you go into questions. What happens when the partner is vaccine hesitant or hasn't accepted vaccine? What do you do? What's the next move there for Bloomin?
It's exactly what you would think. If the partner has any hesitation, we see less likelihood in that staff adopting the practice as well. Because we have visibility into that as well, we then go to the next level, to the joint venture partner. In our organization, one joint venture partner may have 6 or 8 restaurants. And that joint venture partner typically knows the point of view for each partner. So they're keeping an eye on things as well, but they will certainly step in and ensure that the material is out there, the material is on the boards, the material is being shared. And a lot of this information is being used on hot schedules and on policy and different things. So we're not depending on the partner to share the information, except for perhaps getting it on the board. But if that doesn't happen, they can also get information in other ways as well. But again, the JVPs also are keeping an eye on that and can step in.
Right. And the JVPs for years, they can reach out to us directly, and we'll often see on a Saturday night that they'll chat in through our app and and ask a question, and it's because it was posed by the managing partner, not when they were in a restaurant on a Saturday night. But,
right, exactly.
Anyway, Jen, I see you have a lot of questions.
We do. We're getting lots of questions, and we had a lot that were submitted to us beforehand. So I'm going to kind of loosely group the questions. We're going to try to make sure that we get to any questions that folks put in the Q&A. So for those who are listening now, if you drop questions into the Q&A, we will answer them live. So feel free to put any questions that you have into the Q&A as you do. We'll while we're on the topic of incentives, while your vocal cords are fresh, Cathie, we'll go into some of these questions that we're getting live right now around the incentives. So actually, we have one kind of clinical question that I think leads nicely into some of these, which is that some folks are asking about the immunity period after being fully vaccinated. So we know that previously the CDC had said 90 days as a window for immunity. And now that verbiage has disappeared into the ether of the CDC website. So actually, maybe this one could be for you, Sarah, to speak a little bit, just briefly. Is there a window right now on the period that we're considering immunity? We see that the CDC says nothing about when it ends. We're also hearing 6 months thrown about. Can you talk a little bit about that?
I sure can. Yeah. And that is going to continually be an evolving answer. Again, 90 days did go away. Pfizer has some data to support that the vaccine is, lasting for about 6 months for immunity, but it hasn't really, FDA or the CDC has not come out with any recommendations or statements on that immunity window. So again, got to remember that the people who got vaccinated in the beginning, it was maybe those clinical trials were last summer. And then we're really looking at real world information right now in terms of how long that this is lasting. So again, we got to be patient, continue to watch, and get the study information that we have.
Great, thank you so much. And so, Cathie, I think this might be a question for you. It sounds like you're doing a really strong, or I happen to know from insider information through 0 Hour Health, that you're doing a really strong job in terms of vaccine record keeping and incentivization. Are you seeing that you're not having to exclude as much once people are fully vaccinated? And is that another kind of add-on to the incentive in addition to the 2 hours that you're paying them for each shot?
I can't tell you how much that's been discussed because I don't know. But what I can tell you is that we are really focused on getting people comfortable with getting the vaccination versus, well, no, this will prevent you from being excluded later, right? That's probably ahead of us as more people are getting vaccines, but we're not there yet.
Great, thank you. And when you're looking at this, a couple more questions for you, Cathie, around this incentives. I think it's striking a chord with some of our viewers today. Is there any concern around incentives and liability? Is that something that your council has thought about? And also, is that true for all of your restaurants or only for your corporate owned versus franchisees?
Well, I'll start with the latter first. I'm speaking only about our company restaurants. When it comes to our franchise restaurants, we let them know what we're doing, and then they can follow suit or take their own plan. In our organization, it's like 15-20% of our restaurants, so pretty small number. Of course, the legal team was part of the planning team. Our executive planning team included HR, communications, and the legal team. So we are prepared to address anyone who wants to feel like they need an exception, and we take care of that on a case-by-case basis.
Perfect. Thank you. Excellent. So we have a couple more questions here around vaccine, kind of this question of vaccine access versus confidence or hesitancy. And so one of the questions that we got in advance was, do we think, especially based on the poll that we're seeing, we see a lot of people concerned about side effects. We also see a lot of people concerned about how to actually get an appointment, how to actually schedule that appointment. And so I think this is a question for anyone who wants to kind of take a crack at it. Right now, is this primarily a question of access or of confidence?
I'll take that one. Today, we are seeing the difficulty in scheduling appointments as the single biggest barrier to having vaccinated employees. Some of the stories, particularly out of Florida, and Cathie probably remembers this off the top of her head, but one of the senior executives drove 5 hours each way to get his parents vaccinated. Not even himself, his parents vaccinated. And we're going to see that get better over the next month or 2 months. And then I think we'll get to the issue of people who are concerned about side effects. we have some concern that people who experience side effects are going to share those experiences with others, and that may negatively impact who else gets vaccinated. But we also are seeing this really nice example of people going and getting vaccinated, myself included, and coming back and saying, I didn't have any side effects, or the side effect I had was so minor and so brief. So today the answer is, it is incredibly difficult to navigate the scheduling process. We had an employee of our own who showed up at a vaccine clinic on Saturday afternoon for an appointment, and it was closed. So we're seeing all kinds of obstacles like that. So we're not yet to the next phase.
Great. So along those lines, one question we got in a variety of different ways over the last couple of days in advance is peer pressure from employees who want their coworkers to be vaccinated. Is that working? And if it is, can we leverage it?
Sarah, that's in your wheelhouse.
I think it's in everyone's wheelhouse here. So I'm curious, whoever wants to take a crack, but peer pressure, how does it go?
Yeah, Jen, I think this is a hard one because, again, when you think of peer pressure, it really depends upon who it's coming from. If you feel like you're being bullied, it's not going to be effective. If the people that are getting vaccinated are really talking to you in really an open and honest, in a safe space, and just saying, I really want you to be vaccinated, this is why, this is my experience, sharing their stories, that's effective because that's creating that social norm again. And just like, I'm getting vaccinated, this was my experience. So I would say social norms is helpful. Peer pressure in terms of bullying might have an opposite effect. And again, I would just really encourage people to be open and receptive to people's decisions, and not shaming and not coercing, but more really showing why the benefits are and sharing their stories of once they got vaccinated. It's not that bad, and those kind of things is more helpful.
Yeah, and I'll just chime in on the business side of things. There is a very fine line if you're a manager speaking to an employee, of encouragement, sharing information, making it safe, offering incentives, and holding somebody accountable if they don't, right? Or being skeptical about somebody if they do. So if it's peer to peer, that's one thing. But on the business side of things, the approach that we're using of the managers, the partners, the ambassador to the employees, it's a very fine line that we really work very hard not to step across. We try to present information in a very fun, positive, opportunistic way, and then let our folks make their own decisions.
Excellent, thank you both. That's a really juicy question, so I appreciate it. So one other kind of question that's floating around this is a little bit more clinical around transmission. The question of, can vaccinated people transmit the virus? What do we know about it? We're hearing the CDC kind of say a couple of different things, saying we're not sure, and then saying, vaccinated people aren't transmitting the virus. So again, maybe this is for Sarah or for Roslyn, can vaccinated people transmit the virus? How confident are we about that?
Sarah, do you want to take that one, or do you want me to?
I'll start. Why don't you piggyback on what maybe I can say about it? Because again, that is the $1 million question. Again, they're still evaluating this. They need to collect that data on those people who are vaccinated to see if they can if they can actually transmit the virus. There has been some positive studies out there, but we need more information to purely say that yes, vaccinated people cannot transmit the virus, or yes, they can. In theory, we think that vaccinated people would be less likely to transmit the virus, but the risk is not zero. So Roslyn, if you have things that you've heard, please definitely share.
Well, I will tell you that this week we've had a couple of breakthrough cases. And a breakthrough case is when someone's fully vaccinated, and then after, and you're not considered fully vaccinated until 14 days after your final dose. So anyone, and this was probably the single most difficult question we had to get answered since the beginning of COVID, which is what happens if you're exposed but have not reached 14 days after your final dose. And fortunately, we did get the same answer from the CDC, immunize.org, and Bill Schaffner over at NFID, which was if you are exposed before 14 days after your final dose, and I say final dose because it's 1 dose for J&J and 2 for the others, then you do need to quarantine for the appropriate quarantine period. But we have seen breakthrough cases twice in the last 48 hours amongst clients' employees who were vaccinated more than 30 days ago. And I think that that's occurring on very, very low levels, but it tells us a lot about what's going on and what this might look like. We also don't yet have information about, we know that the height of your immunity isn't really at 14 days. Your height of immunity, depending upon which vaccine, may be 28 days out or 56 days out. And we don't know when it starts to wane or drop off, and that we may see more breakthrough cases there, and we don't know the impact of the variants. So, if we somewhat feel like a broken record saying we just don't know, and these kind of clinical trials that we're doing in real time now, that teach us these things with other vaccines have happened years before in their development. I wanted to circle back to one thing that Sarah said that I made a note about. So much of what we know about vaccine communication comes from pediatric vaccines. And we don't have as much of a body of knowledge and experience in adult vaccines. On an earlier webinar, I talked about how one of our clients, Chipotle, had the most experience and was best prepared for COVID based on their prior practices. Bloomin Brands is best prepared based on having offered vaccinations to employees for years, and best prepared for handling this situation, and has the most experience probably of certainly any restaurant group out there, but many businesses, and using the information you have about what worked effectively communicating with your employees on these subjects, gives you a good basis for moving forward. What else do you have for us?
Excellent. Yeah. So we do have a couple of folks asking around, Cathie, you mentioned keeping track of folks' like vaccination status and using that to incentivize that kind of site-specific motivation, those high touch folks, getting back to them. Can you talk a little bit more about that dashboard? What does it show, and kind of how are folks using it to actually help move that middle?
Okay, I think those are two different things. So the first part of your question about the vaccines, I can't remember what did you call them, like where the vaccines are being given? Was that the first part of that question? So
what I meant to ask was like, we know that you're tracking who has actually taken the vaccine and where you have lower uptake, and so how are you using that data that you have around who's actually been vaccinated? Is that what's showing on the dashboard? And how are you actually like operationalizing that data?
Okay, got it. Yeah. So the dashboard is amazing. Like I couldn't believe, like, it's like, are you kidding? So it's a snapshot, and it filters by company, by brand, by restaurant, and then within the restaurant by front of the house and the back of the house. So by company, it has like what every, like the number for every employee, and then the number vaccinated so far, like the aggregate. And then by brand, the number of employees at every one of our brands, Outback, Bonefish, Carrabba's, Fleming's, and then how many by brand have been vaccinated so far. And then you drill down into the restaurant, and on the restaurant page, you can see in the front of the house, the percentage of the front of the house and the back of the house. And all of this is based on vaccinated employees uploading their card so that they can get paid. That's how we get the information. And then from there, we can say, oh, okay, so in my kitchen, I'm at 50%. These are the 7 that are, that haven't been vaccinated yet. In conversation, let me just check in with them. Are you at 1 and you still have the other 1 to go? Where are you? Where are you in this process? And just, again, using empathy and very clear direction and positive language, encourage them to either begin the process, complete the process, or if they haven't uploaded their card yet, help them figure out how to upload the card so that they can get paid.
A shout out to the IT team at Bloomin Brands and the dev team at 0 Hour Health. We are uploading their vaccine tracking is through our system, and we are uploading it, and they found a way very, very quickly. They did what in other times, in non-COVID times, could have been months of development work. They did in a matter of about 2 weeks, so that the people who have access to that dashboard are seeing vaccination tracking data in real time. Somebody
It's
uploads
amazing.
their car, it goes over to, for us, it goes over to Data Studio it's extraordinary. Sometimes I just enjoy this. I'm a geek. I enjoy sitting and looking at it. But
amazing. Yeah, fascinating stuff. We're really, really excited to hear it. And it sounds like a lot of folks were really interested in the way that you're actually kind of doing that, and makes a lot of sense to then understand how can we then use these strategies that both of you discussed in the community that we have, right? Like when we actually know the coworkers, when we actually know the specific manager. So that's wonderful. A really great question that just came through, another clinical one. Should we be doing antibody testing to make sure that employees' vaccinations were effective?
I'll take that one. Because this was, again, a question that had to go to the CDC earlier this week. And the answer is no. The answer is no, because just as Sarah has said repeatedly, there are so many things we don't know. At this point, there's more we don't know than we know about a lot of this. We don't know what level of antibodies affords protection. We don't know how antibodies, again, using that word wane, how they decline over time. And we don't know, we don't know what the antibodies from the vaccine look like really exactly differently than the antibodies from having had the illness. So we do not believe that you should be doing antibody testing. We don't believe you should do antibody testing to allow people to work or to find out if their vaccines were effective. Sarah, do you agree?
I agree. And, and we're really looking at CDC guidance, and in their interim clinical considerations for healthcare providers, it definitely says antibody testing is not recommended to assess for immunity. So I agree, Roslyn.
Thank you.
Beautiful. And so we're running up against the last couple of minutes. I think we have time for one more question. And this is a question that we had submitted in advance, which is, how can we address the potentially negative impact that some of these news stories about the Johnson & Johnson manufacturing mix-up, about AstraZeneca and blood clots, that there are these news stories that are kind of eroding some of the confidence that has been building. I'm curious if each of you or someone wants to take a crack at that one around kind of addressing confidence after those news stories.
I'll go first. I would say call 0 Hour Health.
Thank you.
We did not pay her to say that.
But that's what I would say. Let's go to my credible source.
Sarah, what do you think?
Yeah, so some of the things that we get this question a lot too, and you really have to understand that these 3 their clinical trials were done at different times. They were done at different geographical locations with different amounts of community spread, with different variants of the virus. And they also had slightly different evaluation criteria when they were done. So in the beginning, when their clinical research results came out, yes, it's easy to want to compare. Oh, I want the 95% effective one versus the 66% effective one. But you know what? They're really all good at preventing serious illness, hospitalization, and death. And so in terms of the Advisory Committee of Immunization Practices, which is CDC's advisory board, they recommend just getting vaccinated as soon as you can with a vaccine that's first available. And so that's kind of our theory, is it's really hard to compare. They're not apples to apples. They're definitely apples to oranges. And you really just want good protection against serious disease, hospitalization, and death.
Just one final closing, thank you. One final closing response to that question. We often are now getting questions about vaccine choice, which vaccine, because you're going to certain sites where you could choose J&J, Moderna, or Pfizer, and we'll get these quick questions, even from some of our major client contacts, on which vaccine should I take, and they're very personal decisions, and for many of our clients' employees, taking the J&J is helpful because they don't have to go back. For others, taking the Pfizer is better because you have something, you're traveling, you have a wedding, you have whatever it might be, and it's 3 weeks between doses instead of 4. But absolutely agree with Sarah. The best vaccine for you is the one you can get in your arm quickest, and that's true, across our employee base.
Excellent. Well, it is about time to wrap up. I just wanted to say thank you all so much. This was chock full of incredible information and super actionable. So really appreciate that. It's easy to get stuck in the clouds here, and this is one that we were all really talking about how folks can actually take action in their communities, in their workplaces. So Sarah, Cathie, Roslyn, thank you so much. We really appreciate it. To those who are on the call, we'll send out a recording. We've linked some of the links that Sarah and Cathie mentioned in the chat, and we'll send them out as well with a recording of the webinar. And then we'll do this again next month. So first Wednesday of the month is our monthly webinar, and we'll see you there. We'll send more information out about that. And we really, really are so grateful to our panelists today for joining us.